This is a podcast by the Straits Times.
Now, what we do in these classes through programs and many of the interventions are there is try to correct the misconception. Yes, there's aging, but there are things you can do about it. There are things you can use to support your mindset to say, okay, we can build our muscles with the right sort of exercise. I can help to improve my joint mobility and help to live and cope better with that pain. Not removing it totally, but helping me gain the skills and the confidence to regain my mobility and regain my functional, needs to be more mobile and active.
Hi, I'm Joyce Teo. Welcome to Health Check. Today we're going to talk about why your mobility is your wealth. Musculoskeletal conditions, these are problems affecting our bones, joints, muscles, and tendons. They are the leading cause of disability worldwide. Yet many of us still treat them as minor. We think of them as an inevitable part of aging or something you only deal with if you're an athlete. But did you know that poor habits and lifestyle choices can lead to aches and pains developing prematurely? So today we're taking a closer look at this topic, at what we get wrong about exercise and pain, and what we should do when we actually experience aches and pain. Our guest is Assistant Professor Bryan Tan. He's an orthopaedic surgeon at Woodlands Hospital. He's also very busy looking at how to transform musculoskeletal care for the population as the co-chair of the Musculoskeletal Integrated Care Work Group at NHG Health. Hi, Prof. Tan. Welcome to Health Check.
Hi, Joyce. Thank you for having me here today.
So we're going to talk about musculoskeletal problems.
Yes, that's right.
Okay, musculoskeletal problems, they don't usually make headlines like cancer or heart disease, like you said earlier, right? So why should people be paying more attention to them?
Well, essentially why musculoskeletal diseases has kind of flown under the radar for many, many years is, for a few reasons. Firstly, it's really because it's been sort of construed or thought about as just a regular part of aging. You getting old, getting aches and pains, that's just par for the course. Secondly, it's because it doesn't really kill you, not like cancer, not like cardiovascular disease. And so because of that, it really doesn't sort of get into people's attention. But really, it leads to years and years of pain and disability. And as you rightly pointed out, it's one of the leading causes of years lost to disability in Singapore and the world.
Yeah, but like I mentioned earlier, many people think that it's an inevitable part of aging, right? It's something that you actually reckon with when you're old.
Yeah, no, that is a common misconception. And maybe, let me set the record straight. There is, of course, a biological gradual deterioration of your body as you age. Now, that is normal. But on the flip side of the coin, there is musculoskeletal diseases where it's pain, loss of function, loss of independence, disability. And there are established risk factors that drive you towards that sort of disease-oriented part. So from normal aging or biological aging, which is a regular deterioration, you get to a point where you start getting aches and pains earlier in your life when you ought not to be getting them. And so really that's what we're trying to avoid with the right sort of, habits and lifestyle modifications.
Are you seeing people in their 20s, 30s with this kind of pain and aches?
Oh, we are seeing from all ages. All ages we are, but they're getting younger and younger and younger. A lot of it driven by lifestyle choices. A lot of it driven by things like obesity, because they really predispose to musculoskeletal disease.
Oh, like what kind of musculoskeletal conditions do they have?
So, put it simply, because again, musculoskeletal as a term is sometimes a big mouthful. Right?
Yes,
so
it's a big word.
Yeah, it's a big mouthful. So let me really just break it down into simple terms that everybody can understand. Muscles, bones, and joints. They all work together in synchrony to really, give you that physical body that allows you to be independent and do what you want. So, for example, your bones break down. You get weaker and weaker, you go into osteopenia, osteoporosis, and then you hear of things like, falling down and breaking a bone, right? So that's how a cause of, say, musculoskeletal health can kind of manifest itself as a disease. So that's just one example. Maybe I'll just give another example. Your joints. From something that everybody uses on a day-to-day basis to eventually as your cartilage wear down, and then you get arthritis later on in life. And that's the arthritis that you feel your pain, your dysfunction. That's where a disease form manifests.
And so we want to talk about the stage and what you can do before the pain comes in, right?
Exactly. So really that's the point, because by the time you see someone like me, you are really at the stage where arthritis has set in. Your bones are, as we talked about earlier, koropok, or really, really fragile. That a simple fall can break your bones. But we can do things, and that's really the paradigm shift that we're talking about. We can do things upstream. When we're younger, to prevent that accelerated deterioration of our musculoskeletal system.
That's true, but if there's no pain, how do you know, at which stage you should do something about it because there's nothing wrong with you?
That's the thing. And that's also why preventing musculoskeletal disease is challenging because it's silent. You won't know until the aches and the pains and the fracture and the bone problems come later on. And so when you ask when is the right time to do, the right time is now. For anybody, for any age, at any time. There are things you can do from the time that you are a kid to a time that when you are in your old age to build the right muscles, get the strong muscles, strong bones, and strong joints as much as you can.
What are some of these things that you're talking about?
So fundamentally, some of these things will be things like physical activity. And not just say what we commonly think about getting our steps in or getting our, 10,000 steps, which is what everybody thinks about, right? Health is just about getting our 10,000 steps. And that's not wrong. That's not wrong. Getting your steps in is important to try and get that, cardiovascular fitness up. But what is really important for the musculoskeletal system is to stress the system in the right way through things like resistance training, weight-bearing exercises, and that builds your muscles and bones. Because for your muscles and bones to be strong, they have to be used and stressed to a certain degree in the right way. Yeah,
right. That's a big thing. But is that only for like older people or for everybody?
It's for everybody. So really in the life course of someone, just take bones or muscles, for example. Your bone mass or your muscle mass peaks at around 30 or in your 30s. And then gradually begins the deterioration after that. So in your early age, you work hard to build as high a peak bone or muscle mass as possible. After your 30s, you try your best to keep as active as possible with the right sort of exercises and nutrition in order to maintain or slow down that deterioration of your muscles and your bones to maintain as large a possible reserve as you go into your old age.
So what if you haven't done that?
Oh, it's never too late. Whatever you do, whenever you do, as long as you keep exercising, as long as you keep doing the right sort of exercise, get the right sort of nutrition, you can always build your muscle and your bones. So it's never too late.
Really? But when you're older and you exercise, right, you might get all these aches and pains, more so than a younger person. And that's when people actually stop.
Yes, we were chatting about that earlier about even, not just at the old age, even my own personal experience, right?
Yes.
We were just talking about my own personal fitness journey, right? Going to these gyms, doing a deadlift and, killing my back and being out for a couple of months, right? So it doesn't matter whether you're an orthopedic surgeon or, that's something that happens to everybody. Now, as you get older, of course, yes, your joints are a little bit less supple, your muscles are a bit stiffer. It's harder to get things going, but that does not mean that you don't try. So with the right sort of guidance, doing things in a gradated manner with the right sort of support, physical activity is possible. We talked about gym tonic, right? Gym tonic being a classic example of how we are able to encourage this sort of gym-like environment for the older adult or the elderly.
Right. So for the elderly, quite a lot of them might have some issues, right? Joint aches, pains, and their osteoarthritis. And should they still be exercising if they have, say, bad knee pain?
Yes. So I think the short answer to that is yes, but perhaps I might nuance that answer a little bit more to give you a bit of context. Now, the common misconception when you have pain, and it's taught from young, right? You have pain, you rest. You rest and you rest, right? That's what you say. You rest until you recover and you go. Now, that in itself is not wrong. But sometimes when taken too far, that idea actually becomes detrimental. So what happens when you rest too much? Your muscle gets weaker. Your joints get stiffer. And then you go into this disuse cycle where actually the more you don't use it, the weaker it becomes. And then when you try to use it back again, it just gets worse and worse and you go down this downward spiral.
Oh, I see.
So really that's the spiral that a lot of people get caught at. You try to exercise and then it starts to get painful, you go. Because you've potentially done it too fast or too hard. So what you really want to do is move in a way that doesn't cause you pain, but really just gives that physiological stress to your muscles and your bones to activate it, to get it to start to move and grow and be stimulated to a certain extent. And with that, gradually, again, with the right guidance, with the right sort of support, you then are able to gradually build up your musculoskeletal health.
Okay, because I read that there is this common assumption that if there is pain, there must be something broken inside or torn inside. Is that always the case?
Well, I would say, first and foremost, when there's pain or there's significant pain that particularly lasts for a period of time, do seek the right sort of health professional, get the right assessment, and, get the diagnosis of what is the issue when these aches and pains come. But really, once you get there and you're sure that, it's nothing serious, it's for example, say arthritis, for example. Yes, I know I wear and tear of the knees. And then begins your journey to getting active, getting, physically more mobile, getting that right sort of exercise in to build your muscles and build your bones and build your joints to gradually overcome that initial arthritis that you may have. And so we have seen
overcome it.
You can. So, for example, programs that we have in the community, one example we talked about earlier is called Connect, but other examples are there. Essentially, a lot of what is the biggest thing that these programs bring to the patients? I'll just use osteoarthritis as an example, which is wear and tear of the knee. They come in with a misconception that, okay, I'm old, my knee joints are worn out, it's like a car tire. I've ran its life course and now it's worn out. Surgery is on the cards somewhere down the line and there's no way around it. And I'm just going to have to live with this pain. Now, what we do in these classes through programs and many of the interventions are there is try to correct the misconception. Yes, there's aging, but there are things you can do about it. There are things you can use to support your mindset to say, okay, we can build our muscles with the right sort of exercise. I can help to improve my joint mobility and help to live and cope better with that pain. Not removing it totally, but helping me gain the skills and the confidence to regain my mobility and regain my functional, needs to be more mobile and active.
Without having to go for surgery.
Well, surgery is one of the things where at some point, if, the joint is too worn out or the pain is too bad, yes, surgery is a solution. And knee replacement surgery, for example, is one of the most successful surgery in orthopedics. But having said that, the mindset that is a bit different here is that a lot of patients think, okay, the surgeon is going to solve my problem. Once I have a knee replacement, it's all done. But in truth, the best outcome you get is patients who exercise regularly after a knee replacement, getting stronger, getting back their mobility. So it's not a question of whether surgery or no surgery, but a question of how active can I be, how motivated can I be to get my mobility back and get stronger and get fitter.
I see. Interesting. For those people with pain, you can actually do something about it. You need not actually go for surgery unless you actually reach that point that the surgeon advised you to.
Yes, exactly. So don't feel like it is a done deal. So, there are things you can do to try and overcome it, but surgery is a good option. And with, the latest state-of-the-art technology, surgery is becoming safer and safer, faster outcomes, faster recovery. So it's not a bad option, but do it when you need it.
Not necessary for everyone, right?
Not necessary for everyone. I think the healthcare system can't cope if everybody went for surgery.
I know,
it's
if every
expensive.
elderly person is there.
Yeah,
oh
exactly.
my God. This is interesting. Like, I think I have a friend, she was 42 when she stopped running, and then another person was like late 40s. They haven't really exercised, and then when they started to run, they developed knee pain and they
gave up, yep.
Yeah, because they're like, oh my God, I can't do this anymore.
Exactly. So whenever you start, of course, the later you start, you're fighting against years of disuse and abuse, so to speak, of your body. One of the population health survey really showed that the people who were not exercising the most were in their 20s and 30s. And why? Because this group are the people with so much pressures in life. They are working. They have young children. They have elderly parents to look after. Every Singaporean in that age group can empathize with the pressures of the Singapore society, right? And I can empathize with that as well, right? So, but at the same time, then you're telling them, you need to exercise, you need to lose weight. So how can you talk about encouraging this group of people who are already under so much stress? And bear in mind, stress in itself, or the psychosocial element of it, is also a driver for musculoskeletal disease, by the way. So poor sleep,
right,
high stress, sitting all the time on the computer, typing away with your phone, these are things that drive musculoskeletal disease. So you can imagine you have a multitude of factors that come together that drive this sort of disease burden that we see. So really trying to encourage them, like you say, your friends in their 40s, maybe in their 30s, how can we get them to exercise more, to really gradually incorporate back perhaps some of the physical activity that they did as kids in school? How do we incorporate that back into, routine, regular, working life, which is challenging, but something that really ought to be done.
Right. Okay, so if you're in that age group when you're aging and you have pain,
yes,
what's your advice?
So one, of course, is to slow down. Perhaps you might have gone too fast or too hard, and so perhaps to take a little step back. Get the problem looked at by a professional. Make sure there isn't something sinister ongoing. but really with the intent of getting back onto the horse, so to speak, or getting back onto routine physical activity in a gradated manner, such that it doesn't cause you significant pain. Because like I shared with my own personal story, right? When I tried to get fit, what I did is I went to the gym and I pulled the thing and I did my back in, right? So going too hard, too fast, perhaps that may be some of the issues that we face when trying to get fit again.
But I mean, you're the surgeon, right? So at which point should we be worried about the pain that we are experiencing? Like, how would we know whether it's a sign of a more serious problem?
Right. So oftentimes, pain, of course, is a sign of the warning sign, right? Saying, look, there's something going on here. Take note. If the pain persists, if the pain increases, if the pain starts to spread, I mean, all these are things which would suggest to you that the pain is not just a routine, say, ache, and it's something ought to be looked into. So that is something that we can consider as a warning sign for something to be looked at. But if you were to take your exercise in a very gradated, gradual manner, you should not be feeling these sharp, sudden, prolonged pains, which would suggest that, again, you might have overdone it and maybe you need to get someone to look at it and see whether there's things that has to be done to improve or make sure there's not something not sinister happening, underlying all this driving that sort of pain.
So people should be more careful. But I think people do, after a while, just sign up for like this fantastic long race.
Hyrox.
Before, yeah.
Hyrox.
Or like a marathon or half marathon or something
yes.
before really training for it, but that's not advisable.
Oh, no, absolutely not. You shouldn't. The amount of Hyrox injuries we see is quite amazing. I think there was an article I read recently that talked about what we should do to prepare ourselves to go for something like Hyrox. Hyrox is good. We should well, I wouldn't say, I'm not here to advocate. I don't get paid by Hyrox, right? But I'm
Hyrox is a hybrid.
It's a hybrid sort of, yes. What I'm advocating
right?
for is, good strength-based, resistance-based training. And Hyrox or competitions like this just sort of feed into that competitive nature that Singaporeans have. But really beyond that, as we try to, talk about physical activity, resistance-based training, we want to make sure that we prepare ourselves right for it. For example, the ski season, Singaporeans flock to the region like Japan or looking for the ski. And many of them are not prepared to go. They go there, they break this, they twist that. I get a lot of business when they come back, over this period of time because a lot of people are not prepared for that sort of activity. So, Yes, we want to prepare ourselves, but don't just jump head first into these physical activities. Gradually build yourself out. You condition your muscles and your bones and your joints to be able to take that sort of load before going for these races.
Oh, okay. But is it for everyone? Can everybody do this kind of thing? I mean, when you talk about Hyrox, that's a very intensive exercise.
It is. So Hyrox is not for everybody. But there's things that you can do, on an everyday basis that doesn't have to be Hyrox. Physical activity is one and for all.
It's for everybody.
It's everybody.
And you're never too old to exercise.
Never too old to
But
exercise.
you have to start small, I guess.
Start small, gradually build
pace.
up, and you will try to avoid unnecessary injuries or pain.
Right. But having said that, earlier when you mentioned Hyrox, you said everybody can do Hyrox. That's not true, right?
I would say that maybe I should qualify that statement a little bit more. But not say everybody can do Hyrox, but everybody should be doing some sort of physical activity to something of the level where they are pushing themselves a little bit to do more, get stronger and get fitter. So when I meant Hyrox, it meant like sometimes, particularly I say in Singapore, the competitive nature. So there are competitions that help focus people's attention and focus people's choices to make the right thing. It's a bit like how, exams. Everybody complains about exams in Singapore, but I have school-going children, and me and my wife discuss about not having too much stress on them. Nowadays we're very concerned about overstressing our kids, but at the same time, it's only things like exam that really focuses children to want to study and consolidate that body of knowledge and master it in readiness for exam. So there are certain things that kind of help us focus our attention. So an event or a goal of sort, like a competition, can be that unifying event that focuses your attention and your efforts onto something to achieve a goal. So maybe I'll put it that way.
Yeah, because there's a goal that you're working towards.
Yeah, exactly. Maybe for some it's Hyrox, maybe for some it's running a marathon, maybe for some it's really just getting to the market and coming back with no pain.
Yeah, that's true.
Everybody has their own goals.
Okay, so for people who don't know what Hyrox is, right? It's a global fitness racing sport that combines 8 kilometers of running with 8 functional workout stations. So that's really, really tough.
Okay, first and foremost, I need to say I've not gone for it before. I hope to go for it at some point. I have personally not done it yet.
Okay.
It's one of my midlife crisis kind of things. But from what I understand is you do 8 stations and 8 kilometers of run in total. But having said that, I also know that you can do it in doubles or in a team. So for example, my first time going for Hyrox, I'm not going to do the individual thing. I'm going to do like in a team of 4. So it is really in the same vein of thought that we've been talking about this while.
Okay, interesting. I mean, that's the tough exercise part, but I think we want to talk about, just for the general public,
Yes.
you can actually exercise regardless of your age, regardless of your ability.
Yes.
You just need to put in the effort to actually do something about it, right?
Exactly.
And even when you have pain, you were saying, when you have joint aches, pain, you rest and then you can actually go back to it.
In a gradated manner. So for example, someone with knee arthritis, you have a flare. The thing flares up, it gets swollen. Okay, so you ice it, you rest it. Then gradually you say, okay, I start at 25% of my exercise. Do it for a couple of weeks, see how it goes. Then move on to 50%. Then move on to 75%. So you don't go back straight to 100% after, say, a flare of your arthritis. You gradually build up yourself back to 100% again, and then off you go. So it's a very controlled thing where you're not trying to purposely cause yourself pain or cause further damage, but really just building up gradually.
But what if this person is, say, 75 or 85 years old?
Same principles apply. It's never too late or too hard to do. Take the same principle, start slow, get the right support, get the right professional support, so to speak, in the right situations to make sure and then gradually build up your strength.
I see. Okay, but a lot of people don't, especially when they're older, right?
Yeah.
So that's something I think we need.
The inertia is great. And because you don't see the benefits straight away. The first time you do it, in fact, it's kind of crappy the first time you do it. You feel uncomfortable. But as you build it up, it gets easier and easier and easier. And soon you will feel the benefits. As you get stronger, you're able to do more things that you want to do, you'll feel the benefit. And you'll be encouraged to keep going.
Boy, so it doesn't mean that when you're 70, you can't climb like a flight of stairs or something,
No.
Contrary to some people's advice, like when you're older, you shouldn't do that.
You can, as within limits, like we were talking about. We just saw the Minister of Health do pull-ups with an ATO grandma. So, it's never too late to do something.
Right. Okay, then what about some people who have some issues, right? I was just wondering whether there are any signs and symptoms that people may overlook.
So really that's the problem, musculoskeletal disease. It's silent. It's silent for years. And so the impetus to exercise and to do something on the preventative side is not there because I don't feel anything.
Yeah, exactly.
But really that's the idea. We need to educate, encourage, understand that from an early age, get it in because you will reap the benefits in the years to come. It's an investment in your future. It's an investment into your health.
We should all do it. But any advice for people who should do it but don't? Maybe they're older. Should they go for, say, screening for osteopenia perhaps?
Yes, definitely for osteoporosis, osteopenia through things like your BMD scan, DEXA scans and things like that. These are part of the recommended health screening for people, particularly postmenopausal women. It is definitely part of the screening recommendations. So definitely they ought to be done. And as you see your family practitioner, they will be the ones that can recommend to you when is the right time to do this sort of screening.
For osteopenia.
For osteoporosis,
might be too late.
Yes. Well, you actually won't know which stage. Your osteopenia is like the precursor kind of stage towards osteoporosis. So actually when you do your first BMD scan, you might find you're already osteoporotic. So, instead of waiting for that DEXA or BMD to come, there are things you can do now to not have it go down that path.
That's true, but human beings.
I know, human
That's
beings.
the thing.
Yeah, exactly. Yeah, what you don't see it, you don't feel it. Why do something now?
Exactly, especially when you're young, right?
Yes,
like if you're in your 20s, in your 30s,
yes,
you may not exercise.
So really what we are advocating for is that in the years to come, as an understanding of musculoskeletal health and disease change from a medical research lens, we are finding better and better ways to try and pick this up earlier. So it's not so silent. We shine the spotlight on the problem early, and then from there we can advocate for early preventative, and we educate the public to say, hey, look, this is your result. Perhaps you might want to consider doing something about it now that you know. So hopefully in the years to come, we will see more and more technology and more research that allows us to better screen for this early and unsilence the disease.
But before we end, I wanted to go back to this part where you say that, when you have a little pain, you can go back to exercise, right?
Yes. If you have a little bit of pain, you start 25%. You find that, the pain is not so bad, then you keep going. But suddenly, let's say, I went to 50%, the pain suddenly jumped from, say, 1 out of 10 to 7 out of 10. Then I know I need to stay at the 25% longer, get stronger, get better, then I can slowly go up to 50% and then see how it goes. So let the body guide you. But the message is do something. Don't just wait until there's zero pain, Keep moving, keep active. Movement is medicine, movement is life.
Okay, I thought it was interesting to say keep moving, don't wait until there's no pain, because I think most people will actually do that.
Exactly. So that is the general sort of misconception that we all have.
Okay, great. Thanks for your time today.
No problem. Thank you very much for having me here.
Thanks for joining us today. If you found this episode useful, share it with someone who's been living with just a bit of pain. Don't forget to follow Health Check for free on your favorite audio apps, Apple Podcasts and Spotify. Like us and give us a rating. This episode is edited by Amiru Karim. Thanks for listening.
Send your feedback to podcast@sph.com.sg. Find us on Apple Podcasts, Spotify, or within our Straits Times app. Thanks for listening.